Thank you, Rachel. Good morning, everyone. We apologize for the technical issues and the delay in starting the meeting. I'd like to officially start the November 28th, 2023 meeting of the Developmental Disabilities Advisory Council. I'd like to welcome all members of the council, as well as members joining us from OPWDD and the public. We like to do a little bit of housekeeping before we start. This is being broadcast from 5 virtual locations, five locations, as well as virtually. So we'd like to ask the different locations to mute their lines when they're not in use to minimize background noise. We appreciate you all joining us today and apologize for the delay. We'll start, if we could put up the agenda, Rachel. All right, thank you. We're going to start with a roll call, and hopefully we will have quorum today. Before I do that, though, I'd like to welcome, we have some new members, those new members who have recently been appointed. Tom Avenanti. Tom?
Avenanti, really?
Where are you guys from? Yeah. You work? No. Oh, no.
Eileen Kirk Lewis and Ray Knights. So I'd like to welcome our new members. Now I'd like to do a roll call, and if you could just identify whether or not you're present and also what location you're joining us from. It's important to note that for us to establish quorum for the Developmental Disabilities Advisory Council, we need members. First of all, we need members in attendance, but we more importantly need members in attendance at one of the official locations. So like I said, we have 4 locations in addition to the Empire State Plaza room. I'm going to just do a roll call alphabetically. I'll start with Tom Avenanti.
Present in Albany.
Welcome, Tom. Shamika Andrews. Okay. Jerry Athamas. It's like speak when you, because it's hard to see waves. But welcome, Jerry. Dan Brown.
Hi, Nick. Dan in Albany.
Hi, Dan. Janice Chisholm.
Yeah. Nick, here on Long Island, Jerry. Can you hear us?
Yes, I can.
Okay.
Janice? Donna Falana? Barb DeLong? Barb's in Buffalo, we've heard of it.
I'm here. Barb DeLong is here.
Randy DiAntonio?
I'm here in Albany.
Thank you. Stuart, I know you're here.
Stuart Flowman, the New York City satellite.
Thanks, Stuart. Jeffrey Fox? Gary Goldstein?
Present in Albany.
Teresa Hamlin?
Morning, present in Albany.
Welcome, Teresa. Susan Hetherington?
I'm here. Hello.
Morning, Susan. Ray Knights?
Present, and I'm in Albany.
Ray. Paul Joslin is here with me in Syracuse. We're playing it safe. Today we're supposed to get 5 to 10 inches of snow in the next couple hours. Lynn Kapakis, okay,
Yeah.
In Long Island,
Long
Lane
Island.
Backus.
okay. Suzanne Levy. Suzanne is excused today. Kirk Lewis, I believe is also excused today. John Maltby. Okay. Lawrence McFadden is also excused. Dr. McGinnis,
I'm here, but unfortunately virtual.
Missy Miller.
I'm here in Long Island.
I'm not seeing it.
Robert Petkovsky. Andy Rios Castro.
I'm here in Albany.
Randy. Kai Roman. Sumatra Sarkar.
Present in Albany.
Hi, Sumatra. Lena Schmidt. Hi, Helena. Michael C. Ryder.
Present in New York City.
Oh, your train was on time. Very good. Speaker. She was. Stephanie. Now Stephanie was planning on attending.
Hello?
Leah.
Hello?
Present remotely.
I'm sorry.
Present remotely.
Stephanie?
Remote.
Hello?
Leah, very good. Yeah, okay.
Hello?
Uh,
Hello?
Janice, we can
Hello?
hear you.
Okay, great. Because I've been
No
trying
problem.
to say I'm
Thank you.
present. Thank you.
Larry Valdez. And Meyer Wertheim. All right. Thank you all again. Thank you for your attendance at the meeting. Again, I want to emphasize the importance of attendance. We'd also like to emphasize the opportunity to attend at the closest location. It obviously minimizes travel, and we're encouraging that. We do, though, ask members to be present at the meetings and let us know when we ask for an RSVP so that we can plan whether or not we have quorum. The other thing that I'd like to emphasize, and I know we have some new members, but it's important for us to emphasize to all members, is that we will introduce, John will introduce a number of the committees and discuss, those committee chairs will discuss some of the activities going on in those committees. We encourage the members to join those committees. We encourage existing members to participate in those committees. The work of the DDAC is done through those different committees that are very much aligned with the 507, the strategic plan from OPWDD, and it is where we do most of our work. So we encourage not only attendance, but also participation in one of those committees. The other thing that I'd like to also say is that we are working on a revision to our bylaws. We've got a draft that is been in process. We hope to share that with members in the next month or so, and then we will put it up for a vote at the next meeting. And we'll review the next meeting dates and location, or well, the next meeting dates and the end of the meeting. I'd like to just, everybody should have received a copy of the minutes. Just like to ask for an approval of the minutes.
I move.
Paul Goslin moves to approve the minutes. A second.
Second.
Second, and all in favor?
Aye.
Aye.
Any opposed? Okay, thank you. Well, with that, I'd like to turn the floor over to Commissioner Nifel. Good morning, Commissioner.
No? Okay. Good. Okay, morning, everyone. Nice to be here. Nice to see everyone. And happy holidays. We're in that season of the year. And I want to just thank everyone for your continued commitment to the Developmental Disabilities Advisory Council and welcome to the new members. And also just want to quickly mention that we also have with us Kristen Crow, who's officially the new Executive Director of the Council on Developmental Disabilities, which was formerly the Developmental Disabilities Planning Council, was changed in legislation this year. So I don't know, Kristen, if you want to just say hi and take a minute.
Thanks very much, Carrie. Good morning, everyone. This is my, I guess, third week officially as the new executive director of the CDD. We now call ourselves instead of DDPC. Our deputy director, who all of you know, serving as the interim or acting executive director, Vicki Hypens, retired. So I have joined the council and I'm getting to know the staff who are terrific, as well as our council members who are absolutely wonderful and contribute in many different ways. So we have a lot of exciting things coming up. We have a housing video. It's previewed as in the final stages that I'm very excited about, showcasing one of our grants for the Master Housing Navigator. But I think it's going to be a great model for hopefully other places to stay, to jump off from and learn from and do some development of their own. So we have a lot of exciting things coming up in addition to our name change. And I'm really delighted to be there. I come from the Department of Health where I served 3 commissioners throughout the entirety of the pandemic and worked in the executive chamber under 3 governors prior to that and served as the commissioner of the Office of Temporary Disabilities. So long history in government and also some not-for-profit work in the IMD field in the Capital Region and a lot of volunteer work as well in the IED field. So all of you. Thanks.
Kristen, we're very excited to have Kristen both at this, I was going to say that you speak at the CDD and on the council here. Obviously, brings great experience and great partnership. So just a few things from me, and then we have a couple from other team members at OPWDD, a couple of things we'll go through. Obviously, we're coming up on the legislative session, beginning to think about executive budget release and the state, and then we will have the legislature back here with us in January. So I know folks are busy and active during this time, and we appreciate everybody's advocacy, continued advocacy on behalf of the needs of the field. Want to talk a little bit about workforce, speaking of advocacy. I think folks know that at OPWDD, we are doing our very best to take a very holistic approach to supporting the workforce and, specifically direct care workforce, but also our clinical and administrative staff across both our agency and the provider agencies. And I want to take just a minute to highlight our partnership with SUNY and with the National Alliance for Direct Support Professionals, because it's very exciting. And it's producing really great work. And for folks who aren't aware of it, I want to make you aware. And certainly for providers or for DSPs who are listening, to be able to connect with us and get some more information afterwards would be great. So we have been partnering with the National Alliance for Direct Support Professionals, which I think everybody's familiar with that group, and Joe McBath and the work that they do to support DSPs and really to professionalize the work of the direct support professionals. So we've been partnering with them through our ARPA program, and able to fund that with our ARPA funds to provide credentialing to DSPs. We've partnered with over 30 providers and the National Alliance to bring credentialing to DSPs within provider programs. So far, we've had close to 1,000 DSPs within those providers receive their credential. There are 3 different levels of credentialing and even a frontline supervisor credentialing that people can participate in. And we've heard really incredible feedback from the staff of the voluntary agencies that are participating with this. And then also using the same curriculum, similar curriculum, and partnering with the National Alliance for Direct Support Professionals. We're working with SUNY. We're currently on 13 community college campuses, soon to expand to 20, although I'm not sure if that's official yet. But soon to expand to 20 community colleges, where we're working to provide micro-credentialing on those campuses to DSPs or to students who are already on the campus. And so what it's doing is providing an opportunity for existing DSPs to go to a community college campus to receive the micro-credential, to earn college credits while they're getting that micro-credential to become a certified DSP. And what we're hearing is just really great feedback from DSPs, both about the curriculum that they're taking and how it's enhancing the work that they do as a DSP, and how being on a college campus, receiving the certification, getting college credits is also enhancing them as individuals. And people, I think, are really feeling invested in by OPW, by their employer, by a provider agency, and are really appreciative of the opportunity. So we're very excited about this. We've heard, like I said, just really incredible feedback from folks who have gone through, talking about, I've met lots of DSPs who have done this, some who have many, many years of experience, one who had 30 years of experience, who talked to me about how going through the micro-credentialing helped them to better understand their job and how to respect the dignity of the people that they're working with. And they took value out of it after 30 years of doing this job. And this is obviously a really committed DSP who's been doing this for so long. We've also heard DSPs talking about how exciting it was to be back on a college campus, how they started getting their degree 10 or 15 years ago. Life happened, right? And they weren't able to complete it, and how exhilarating and enriching it was for them to be back on a college campus, to get these college credits, and that they're going to use them to continue going for their associates and for their bachelors. And so I think it provides a lot of opportunity, a lot of investment in our staff. And it also provides opportunities for career ladders, right? We know that people can start as DFPs and get that associate's degree, bachelor's degree, go to school for nursing, and continue to grow in our field as professionals. And it feels really good as an agency, and working with the providers to be able to invest in DSPs in this way. So very excited about that. Just wanted to take a little bit of time to share more about that. If you have any questions, or if you're a provider and you're not working with us on that and you'd like to, please you can follow up afterwards. Wanted to just give an update quickly on the evaluations that we're working on. I know that there is always a lot of interest in the evaluations that we're working on through our ARPA program as well. The first is the managed care evaluation, which we've talked a lot about. And I think a lot of people here have participated in the information sessions that we have hosted with Guidehouse, our contractor that's evaluating managed care. Soon we'll be posting on the website a summary of the stakeholder feedback that we've received so far through the town halls. We'll also be launching a survey so that folks who weren't able to participate in the town halls or didn't feel comfortable participating in the town halls can still provide feedback through the survey that will be released, and we'll be doing a message so everybody will have access to that, and it will be up for several weeks. Guidehouse's work will end in the spring of 2024. With a report to OPWDD, and we'll obviously be making that available to the community. So more to come on that. We've also recently entered into contract and launched our CCO evaluation. Another area as we've been working on the strategic plan and out hearing from stakeholders, an area that we hear from stakeholders a lot, and looking for us to continue to invest and evaluate in the quality of care management. And we've been working closely with the CCOs themselves. Across OPWDD, as the CCO program obviously impacts so many different divisions within OPWDD and everybody in the community. So that evaluation is ongoing. There will be plenty of opportunity for stakeholder engagement there as well. We know folks have a lot of experiences to share, and we're very excited about that, the opportunity to work with CCOs to continue to improve the quality of care management for people who receive services. And lastly, we'll be announcing soon the awardee for our self-direction evaluation, another area as we're out on the road receiving feedback from stakeholders. Another area that we hear a lot about is self-direction. And we obviously value very much our self-direction program and want to see it continue to be successful and sustainable. So we're investing time and energy both into the program as it exists right now and to looking at ways to continue to revamp the self-direction to ensure its success in the long term for people who receive services through self-direction. So excited about that. We also have a few actions through CMS that Kate Marley is on virtually, and she'll share a little bit about. We have a recent waiver amendment approval, and we have approval from CMS of a transition plan and a corrective action plan related to the HCBS settings rule. So I'll turn it over to Kate for a few minutes to give us a brief update on that, and I'll come back.
Great, thank you, Commissioner. Can folks hear me?
We can hear
Yes,
you.
okay. Wonderful, thank you. Okay, so I'll start sort of, in sequence of time here. We did get approval for Amendment 14 that was effective 10/1/23. And that was an initiative that we put in place largely because we were coming to the end of the public health emergency and the coverage of the Appendix K, which provided us sort of different operating rules for the waiver during the pandemic. So I think we were very, very much successful in getting most of the items approved from CMS that we requested. So in this amendment, we made permanent certain features that were changed during the pandemic. So for family ed and training, we continued the allowance that these services could be delivered remotely. We also raised the fees on a permanent basis for intensive behavioral services. Those had been raised during COVID, and now those increased fees are permanent. We also made a series of changes that that sort of it continues some of the flexibilities we had, but also allow us, we hope, to operate in an ongoing fashion more effectively. So some of these technical changes included language that would mean if once COLAs are approved, so the legislature, for example, next year, if they approve a new COLA, we can go ahead and implement those values in our fees and rates without having to do another amendment. So that should be more efficient in helping us respond to future legislative actions of those natures. And on a similar vein, the PRA for the personal resource account table for self-direction and the IDGS, individual directed goods and services, which is a service that also supports people with self-direction. Those values were hard-coded in our waiver. We were able in this amendment to pull those out, so they will now be available on the website. But we will be able to adjust in the future without, again, having to wait for another amendment. So hopefully that'll just sort of increase efficiency. The big thing I wanted to talk about, which I think most people have heard, there were two programmatic initiatives that we were implementing or attempting to implement in that October 23 amendment. The first of which we were successful in. So we have added a service called Home Enabling Supports, which is under the umbrella of assistive technology. But our hope is that as we begin the rollout of this service, which will happen, during 2024, what we will do is be able to increase access to low cost, readily accessible technology to help people live more independently. So more will be forthcoming with that. The other programmatic request that we were not successful in launching was we were hoping to create a senior respite program that would allow people who lived in residences as an alternative to other day services to be able to participate in more retirement-focused respite programs. That was not successful. We are looking at alternatives, but that particular design was not approved to continue. Other than that, we were, I think, very successful. I also wanted to talk for just a few minutes about the HCBS settings transition plan, but let me just pause there and see if there's any questions about the waiver amendment. Okay, hearing none. And if someone does come up with questions, feel free to email me. And of course, everything is posted on the website, including the response to public comment. So now, I'm sorry, is someone asking a question? No, okay. Okay, so the next topic I wanted to address was the HCBS settings transition plan. So just to put this in a little bit of context, all the way back, I believe it was 2014, there was a new federal rule called the HCBS settings rule that now came into full implementation in March of 23. Part of that process, which was a multi-year process, required that every state submit a transition plan to CMS for approval. That transition plan had included sort of a review of existing sites versus the expectations of the new federal rule, and then sort of bringing those together and demonstrating to the federal government that we can continue to deliver HCBS waiver services in the settings that we now have. So we completed that work, and I'm very pleased to say that New York State's transition plan was approved. That is a statewide document, so under the lead of the lead Medicaid agency, NYSDOH, the Department of Health. But obviously OPWDD has a very sort of large, and I think, obviously from our perspective, very important piece of that transition plan. So that is approved, but there is sort of another piece of that, and that is called the CAP, or the Corrective Action Plan. So when CMS sort of just made the decision last year that they were going to they were actually going to make the rule effective March 17th, 2023. They had to acknowledge that we were still, finishing up the public health emergency, and operations really across the nation were not where states would want to see their operations in terms of achieving the goals of HCBS settings. So what the feds offered, federal CMS offered, was that we could request a corrective action plan for areas where we felt our performance wasn't exactly where we wanted it to be. And that sort of initial corrective action plan is part of our statewide transition plan, which we can provide the link to. It is available. The two areas that we decided that we really needed to focus on is, first of all, community integration, which obviously has been made very challenging during and throughout the COVID period, but also employment, where we had seen a real drop off during the COVID years in the numbers of people who achieved independent employment. So those are two areas of the corrective action plan. We just received the approval of the plan. So we don't have a lot of operational details about what that cap means, but there will be more information coming as we are able to sit down with CMS and meet with them and fully understand what they're going to expect from states in order to navigate that cap and then ideally close it out. So, two fairly big pieces of action there. And I think that's pretty much it, unless there are any questions. Okay, hearing none, Commissioner, back to you.
Thank you very much, Kate. I also wanted to take a minute. At the end of the meeting today, we will be going through the 2024 schedule, letting everybody know the dates that we have scheduled and the locations. But right now, we're going to spend a few minutes going over some boring administrative business, but important nonetheless, related to our travel policy. So we've got someone from our fiscal team, Neil, has joined a call. He's going to walk us through our updated travel policy. It's important for folks who submit for reimbursement for travel to and from the DDAC meetings to understand this. So we'll walk it through. And then obviously, as questions come up, as people are filling out paperwork and submitting for reimbursement, you can always reach out to us to get assistance. But wanted to walk you through sort of the basics now. So is Neil on?
Yes, I am. Okay, thank you, Commissioner. Hi, greetings to everyone. I am the Director of Statewide Fiscal Services, and I've been asked to speak to you today about a new travel policy that's being put in place, really kind of solidifying, I think, some existing rules and aligning it with sort of with OSC guidance. So what I'd like to do is just walk through that. You can feel free to stop me at any point and ask questions or ask questions at the end. And I know that if you have, kind of more ongoing questions related to your personal reimbursement, that we can follow up on those after for you as well. So this is a travel policy for committee members we'll be posting to the website in the coming days. It applies to the DDAC, FSS Committee, and the Autism Spectrum Disorders Board. So generally the stakeholders committees, and it's effective January 1st, 2024. So the purpose is to define how members of these groups are reimbursed for necessary travel. And one note to mention that's also referenced in the policy before getting into the process is that OPWDD asks people to attend at their nearest regional location when there's a multi-site event or to seek pre-approval for travel to a central site if that's not possible. I believe you already know that. So let's just go through this. Basically, when determining the reimbursements, we go by the travel manual published by the Office of the State Comptroller. And so this is laying out basically the guidelines for all of the state business. So a few points to note in the policy include that as a representative of this group, the DDAC, you are considered a non-salaried public officer. And so consistent with OSC guidelines, you're thereby entitled to reimbursement for actual expenses incurred in the performance of your duties. OPWDD elects to rely on a receipted method for travel reimbursement to ensure that any appropriate, necessary, and related expenses are reimbursed. So just going through the different categories for reimbursement, and I wanted to note we'll provide links to all the rates mentioned in what I'm about to say. For overnight travel, pre-approval is needed. Requests are asked to be submitted 30 days in advance. For lodging, we can reimburse up to the federal reimbursement rate based on the county of lodging, and receipts are required for that. For meals, we go by the per diem rates by county. Reimbursement is based on the appropriate amount attributable to each meal as defined by OSC. And this allows for reimbursement of dinner the day of the meeting and breakfast the following day. For day travel, there's some rules that are kind of laid out by time of day as to whether you can get the breakfast or the dinner reimbursed. So you'll see that included. And then for actual travel expenses, these can be reimbursed with receipts. So this does include the cost of traveling to a bus station or train station from home. It also includes tolls, and we can reimburse mileage per OSC rates for the personal mileage, personal vehicle mileage rate reimbursement. That rate is all inclusive of gasoline, wear and tear, etc. So just to reiterate, we'll provide links to all the rate information I just noted that's in the policy. And if you have questions, feel free to reach out through the DDAC liaison, and we'll be happy to provide answers to those. That's all I had. Thank you.
Thank you, Neil. So the last thing I wanted to mention, which I should have mentioned actually during our workforce segment and I forgot, was that we have recently entered into a contract with Vibrant Communication, which is a local media company here, to work on a multi-million-dollar marketing campaign related to recruitment of DSPs. So we're working with Vibrant to create the material. We have a work group that's comprised of both state and voluntary DSPs themselves, family members, people with developmental disabilities, and OPWDD staff, as well as staff from voluntary agencies, to help create the marketing material. And then we will be doing, significant and substantial media buys across the state, all focused on recruitment. We've also been working as part of and sort of a complement to the marketing campaign. We've been working with the Alliance for Innovation and Inclusion to create recruitment and retention toolkits for providers across the state. So working with McSilver, the Alliance put out an organizational self-assessment related to recruitment and retention that went to providers and sent into state operations, the administration to complete, and then also to DSPs themselves to complete. so that we can begin to understand what are the challenges related to recruitment and retention. The Alliance and Big Silver are now working on a toolkit that will be available to providers and to OPWDD, and that will complement the work of the marketing campaign. Hoping to be able to continue to highlight the incredible work that staff are doing across the state. And for folks who are interested in getting into this line of work and into this profession, help to funnel people towards those resources so they can begin to understand who are the providers in your area who are doing this work, how they can apply for jobs. And then obviously the toolkits that we're creating hopefully will help us to continue to retain our incredibly valuable staff. And then also working with the National Alliance on the micro-credentialing is just another tool for retention and helping to professionalize the workforce. So I wanted to make sure to mention that because we'll all be able to benefit from the fruits of that work. So that's it from me. If anybody has any questions or discussion, I think we have time on the agenda for a little bit of discussion. Hey, Gary.
I don't know who developed the business plan for direct care. It's brilliant. I think it's a wonderful plan. It sounds to me like it's going to really help. And I hope the rest of the board feels the same. One of the items DDPC in the past has provided dental task force with caregiver training and mental health materials. They supported our development of that. We've launched that prior to COVID. If you're interested and it's something we could be of help with, please let us know. Because it's something I think the dental group would rally around and offer ongoing classes and caregiver training.
Great, thank you. And, shout out to our Division of Administration, who's been leading the efforts on the credentialing for the DSPs with the National Alliance for Nurse Professionals. They've been great. And I think we should connect on the dental work and the CDD's role, and we can look at the long term.
I think I just wanted to mention on the dental front, not putting a plug in for any particular provider agency, but the Center for Disability Services, which is here in the Capital District, has an incubator location now where they are supporting the development of a number of different tools and other innovations to assist both individuals with IDD and other disabilities, as well as their caregivers. And one of the things that they have developed, and I not have a patent on it, I know they have patents on a number of things that have been developed at the incubator location, but it is a oral hygiene tool to try to make it easier for caregivers to assist with help with oral hygiene. So certainly I'm happy to get information from the center. I know that they're very pleased with development. It's been a long time in the making. Absolutely. As well. And while I have the mic here, do you mind if we just ask the credentialing, which I think is phenomenal, and micro-credentialing and the story about the DSP has been in the field for 30 years. First of all, kudos to somebody who has stayed COVID through it all. Is that credentialing, micro-credentialing being offered at no cost to the DSP?
That's correct, right? No cost to the DSPs, and actually the DSPs receive a study fund from participating that they can use for lots of different things. Childcare. Some providers are even providing laptops or tablets in order to facilitate DSPs in taking their credentialing, since a lot of that is self-paced work online. So it's all benefit to the DSP themselves.
You answered my second question, which is in person or online, but it sounds like it's hybrid.
Right. Ready?
I just had a question. I feel like last year or the year before, OPW issued.
We can't really hear whoever the speaker is. We're not really able to make out what they're saying.
The words are not coming through. It's all gibberish.
I'll try to be louder. I've never been accused of being
louder. I don't know about louder. I think you need to be closer to the microphone because there's echoing bouncing off the walls. Very hard to get sentence structure there.
Is that better?
I'll let you know.
Okay. So I had a question. I think it was last year or the year before. OPW had reached out to the University of Minnesota and they were doing a study on workforce grants and initiatives. And then it got delayed. There was some technical issues, and I don't recall ever seeing it get resent or get the data around it. Was that ever completed?
So, University of Minnesota is evaluating all of our ARPA initiatives, or the majority of our ARPA initiatives, where we're spending money to understand the effectiveness of that. It's just that the information is not available yet because the ARPA initiatives are ongoing, but that will be publicly available.
Do you have any anticipated deadlines, or are they giving you data as it goes along on certain initiatives, or is there?
We have, sitting right next to you is our Office of Strategic Initiatives, and they're the lead on our ARPA initiative, so I'll ask them to answer the detailed questions.
Sure, so I think.
The investments.
We don't know.
Hello? So the investments that were made through ARPA were initiated a little bit over 18 months ago. So the data that is being compiled to assess those investments is coming in. So through our, different investments around workforce incentives and bonuses, that information is being collected, as well as some of our other activities that I think Gary just spoke to in terms of the micro-credentialing, so it's basically culminating all of those different investments and really pulling that together to conduct that assessment. But we can take that back and prepare an update for our next meeting. That would be helpful, just to give you a status on where the evaluation stands today. I think that would be helpful, and the one thing I would ask that we get a specific update on is there was a point where the OPWDD workforce was being surveyed, but that survey was stopped because I guess it was being outside entities were getting access to it. So I just want to make sure that we're able to get that data back. Thanks.
Yeah, so, there might be, I'm not sure, I'm just informed, so there's the University of Minnesota evaluation, which is working with all of the workforce grantees that the commissioner had mentioned. And they're doing quarterly reporting and creative reports for the grantees, so you'll be able to see some of those updates as we release strategic plan updates, we embedded in that. But then there was also one of the projects that the commissioner mentioned on, with the New York Alliance, where they were doing a survey of the workforce, including both the voluntary side and the state side. So that might be what you're referencing, so but that information. Yeah, they were doing a survey of staff and then providers on both sides, of the whole workforce, and then pulling that together to create the resources, which the commissioner had, which is these. So they're sharing resources out, pulling those together, and we sharing those out with both the state and then also with the voluntary side, based on you should see more of that. So I'm not sure if that's what you're.
That's what I'm.
I think John has a hand up, and then
Yeah. And in terms of BSP recruitment and retention, I hope that they don't forget to look into increasing the opportunities to live in caregivers and for paid neighbors, and focus on the section 131 of the IRS code that makes any earnings that those folks receive in the place that they live and work exempt from taxation, which is a real benefit to DSPs if you like.
information to make sure we include in the toolkit as we're looking to support the work. Thanks, Sean.
Commissioner, a couple of things. Started off with, of course, I'm going to violate the first rule of joining the committee. You're supposed to be quiet the first time.
Somebody would expect you to be quiet.
Exactly. My history proves that I won't be. On the issue of dentistry, we found in the past, I've looked into this issue, and big problem was the availability of operating rooms. If OPWDD could somehow reach out maybe to the hospital association and work out something with them to make sure that operating rooms are available for dentistry. So many people with disabilities need to have anesthesia, full anesthesia. And from personal experience, the only times available are 7 o'clock in the morning, which for people with disabilities is very difficult. Not to mention how difficult it is for their families and their caregivers. But if you could reach out somehow, maybe get the hospital association to work with their hospitals to find those places that have excess operating space and to make it available on a systematic basis to those who want to do this type of work, doctors who want to do this type of work. That would be the first thing. Secondly, I applaud your efforts to try to encourage people to become DSPs. And I can't, the efforts that you're making a lot of. But in the area where we are, in northern suburbs of New York City, it's all about money. I spoke with just one agency. Over the last several months, they interviewed 8 people. Soon as the people found out how much they were getting paid, they walked out the door. 5 out of 8 walked out the door. 3 are still apparently going to get hired. It's not a lot of people. It's only one little agency from, one area in their agency. But $19 an hour in an area where Amazon is purportedly paying $25 an hour and McDonald's is paying $22 an hour with no responsibility, so that they show up and do some work and get paid. It just, so we can do all the advertising. I'm pleased to see that you're doing the credentialing, but I think that keeps people rather than losing people out going to do. I don't think it attracts new people. So I think we really need to look at a cost of living differential at different parts of the state. In your rating, I don't know if you do that today, but certainly what you pay upstate is very different than what you need to pay downstate. So there is, like I said, just from anecdotal evidence, we really have a shortage of DSPs in the northern suburbs of New York City. And I hear the same case. Thank you.
Yeah, thank you. And I just wanted to mention on the OR availability, I don't know how directly tied the OR availability is to the rate that is paid. But in last year's budget, there was an increase in the rate that's paid for OR dentistry services. So hopefully we'll see that will correlate with a little bit more availability. But we know obviously that it's an issue that's very important. We obviously work with the medical and dental task force, Dr. Pettinger, who I'm sure is on, and Rachel, who is our webmaster today, but also works on policy at the agency. Work closely with the department, looking specifically at dental policy and dental rate making. So it's an area that's very much on our radar.
I don't think we could ever compete with the high rates that they get for more complicated surgeries. So I applaud that as well. I mean, that's helpful. But I think it's going to have to be more somebody in the hospital association identifying those places where they have excess capacity, if there are any such places.
Yeah, I'd like to invite you to attend our next dental task force meeting just coming up. Let's get you an invite, as well as a health and wellness committee where Paul Glassman will follow up on the talks he's given the past on shortening the line, efforts California is making in this regard. And also you'll hear about some of the efforts to see the effects of the increase in the budget dollars on operating rooms throughout the state. And so that would be a good spot for you.
You think that's working?
No, I don't know if it's working. Yeah, we don't know if it's working yet, but we're trying to evaluate if it's actually working. Not convinced.
Good set. Well, make sure we stay on time. It's probably a good segue into the committee reports, which we'll be talking about. I know dental care, you've got that report coming. Any other quick questions for the commissioner, comments? I see Long Island. I see a hand up.
Yes, I'd like to know the Georgetown report, on equity and diversity. Were those results in?
Sure. So there's not necessarily a report that's coming out from Georgetown or results that we'll be publishing, but where our work with Georgetown is ongoing on multiple fronts. They're working both with us as an agency on our diversity, equity, inclusion, and belonging efforts. They're also working on hosting town halls and stakeholder engagement sessions. There'll be 2 different tracks for that. One will be for people with developmental disabilities themselves, people who have lived experience of having a disability, and their family members or caregivers or circles of support. And then there will be a separate town hall series for providers All with the effort of trying to understand, talking about people's experiences, in our system, and its intersection with diversity, equity, inclusion, and belonging, which will give Georgetown a lot of information, to begin to provide recommendations to us as an agency, and to our providers, on how we can continue to increase our efforts in this area and really bring diversity, equity, inclusion, and belonging into the sort of forefront of the thinking on all of our work, rather than having it be sort of a separate, domain of work, really bringing it into the fabric of everything that we do every day. And that's really the substance of the efforts that we're taking at the agency as well. And they're providing significant professional development to our staff. So that work is
So when
ongoing.
do we ever get to hear any feedback, or what the dialogue is, what they're hearing, what they're finding, what we're doing about it?
There will be opportunity for that following the stakeholder engagement sessions that haven't happened yet.
And also, I was on the original meeting and they were using census data, and there was no LGBTQ census data taken in the last census. So I would like for you to make inroads to make sure that they are including LGBTQ people in whatever they're doing.
That's a great point. Thank you for raising that. We'll make sure to raise that with Georgetown.
Thank you.
Thank you. Now let's move to committee reports. John, do you want to take over this section?
Thanks, Nick. So we're going to go through the committee reports as part of the agenda. We can move to the first one later. It's going to come from Paul Jocelyn. Paul is in Syracuse. Paul to report on the residential code.
Thanks, John. I first want to point out, obviously this slide shows the current makeup of our committee. I want to thank Kirk Lewis, who has agreed to step into the co-chair role, filling that position that now needs to be filled by a member of the DDAC. Also want to thank Chris Liuzzo, who has been in that role previously, and also acknowledge a new committee member, Ben Taylor, who has joined the committee as representative of Disability Rights New York. Of course, not included on this list are the OPWDD staff that attend our meetings. I looked at our attendance earlier today, and we have had 9 OPWDD staff attend almost all of our meetings, except for one where there was an internal OPWDD meeting that prevented some of those staff to attend. So I just want to thank the staff who have attended those meetings. Their contribution to our discussions has greatly improved the work of our committee. Moving on to the next slide, if I could, Rachel. Want to highlight a bit of the work that the committee has been involved in. The DDAC received a copy of the recommendations with regard to the housing subsidy ADM back on November 16th for you to review ahead of today's meeting. We will have a vote on those recommendations either at the end of this report or later in the meeting. Also want to point out that those recommendations were prepared in collaboration with OPWDD. We had several people from the residential committee on the subcommittee that handled this work. That subcommittee was chaired by Seth Greenman and did a great job, but also wanted to acknowledge and thank the OPWDD staff who were involved in this work as well. I also wanted to mention that while we are voting on these recommendations today, OPWDD has already made some changes that address at least a couple of the recommendations. Moving on to the key areas of discussion, there have been several, as you can see. First, I wanted to provide a quick update on the certified residential family roundtables. This is an effort of our committee to reach a broader group of family members who have someone living in a certified residential program. It's worth pointing out that 42% of this committee is made up of family members, and nearly 1 in 5 are a family member who lives in a certified residential program. However, we wanted to broaden our outreach and hear from more people across the state. We held our first roundtable earlier this month and heard from a handful of family members about concerns they have with the certified residential program. And we will be having several more of those roundtables to make sure we hear from people within all of the OPWDD regions. Wanted to thank Karen Azarian, a member of our committee who has been leading that subcommittee. We've also had quite a bit of discussion around barriers to non-certified housing. one of which is being addressed through the recommendations with regard to the housing subsidy again, I mentioned earlier. We've also had some discussions around increasing the number of non-certified housing opportunities and heard from OPWDD on the next round of integrated supported housing funding, which will be made available late winter or early spring. And we've also had some discussions regarding the supported integrated housing pilot, which was a enhanced FNAP opportunity. And those conversations with OPWDD continue. As Kate Marley mentioned earlier, one of the new services made available through the recent 1915C waiver amendment is housing home enabling supports. And we had a very informative presentation from her on the details of what that includes and when that will be rolled out. Very important for the community to hear about that work so that it can inform our work going forward. We've also had some discussions around a housing policy for the future, and our committee has formed a third subcommittee that is meeting to work on that housing policy. Here again, this is a joint effort with staff from OPWDD, which again has really helped those conversations. And last but not least, a couple other key areas of discussion have been the group home closures and the workforce shortages that is the major cause behind those closures. The commission already talked about some very important initiatives geared towards improving the workforce, so no need to get into those anymore. But that issue continues to be a priority for the committee and will continue to be part of our discussions going forward. Last but not least, we've had some discussions around a recent federal housing opportunity, Section 811, which is a HUD-initiated investment of $212 million nationwide to increase affordable housing options for people with disabilities. It is quite a complex endeavor, as you might imagine, but there's been some initial conversations with OPWDD about whether OPWDD in New York State intends to move forward with that opportunity. I covered those fairly quickly, so I'll stop now to see if anyone has any questions on any of that. Hearing none, I'll just mention that the key concerns we've really sort of talked about already, group home closures and staffing.
We have a question.
Oh, sure.
I would like to hear a little bit more about the committee's discussion on the group home closures. I can tell you, being from the upstate area, that we are experiencing probably the highest number from Syracuse West. Our last count, over the last few years was upwards of around 60 state-operated group home closures. Over the last few months, we've heard of some private voluntary agencies in Buffalo. And I'm just curious what the committee's discussion was as far as some of the strategies. We heard today about recruitment, but I think part of the problem is we are seeing great things happen as far as getting people in the door, but we're not seeing such great things happen keeping them. And it's a lot of training and a lot of effort to bring people in who are then leaving very shortly thereafter. Part of what we're hearing is around the mandations that have ranged from doubles to quadruples on the state side of our direct care, but also I represent the clinical professionals. Our members have been willing in some instances to do overtime, and there hasn't been as robust a response to those initiatives. So I'm just curious what the committee's discussion was as far as next steps, because we're still seeing this train continue down this road.
Yeah, it's a great question, and one I think that there's not a clear answer on. We did have I would say an active discussion on recruitment, but as you point out, retention, turnover is also an issue. I can speak to that personally from the experience as a provider, that it is not just a recruitment issue, but a retention issue as well. And we did share some examples, and I can share those meeting minutes with the committee for anyone that wants to see to have a better understanding of what we talked about in those meetings. But I can honestly say that there's no clear answer to this, no clear solution to this problem. It is a very complex one and one that is going to take some time to resolve.
I appreciate that. I would appreciate the minutes. I'd also like to ask to be part of the subcommittee if there is one on group home closures. And I can tell you what we hear a lot is the need to have their schedule include guaranteed days off. One of the things is the lack of flexibility. If everybody has to work 8-hour shifts instead of working 12-hour shifts, things like that, I think have been successful with some of our other titles, not necessarily at OPW, but we've gone to a lot of 12-hour shifts in a lot of different agencies because people want more work-life balance and it is an incentive to stay.
That's a great point. Thank you for sharing that, and we will be sure to add you to those discussions going forward. Any other questions on the work of this committee?
I have one question. Yeah. Do you have any numbers on the number of people on waiting lists or home spots, particularly by region?
Yeah, that is also another great question. We, to my knowledge, we don't have that information to date. We've had some discussions about a data request to OPWDD so that we have better numbers with regard to that, but we don't today.
The latest I've seen was numbers sometime last June. I think the agency estimated they were 5,400 or something like that, people on a waiting list statewide. And I was wondering what the numbers were, today, and also if it could be broken down by region, that would be helpful.
We can certainly make that request. I do recall seeing the numbers you reference, but not a regional breakdown. I will say that this goes more towards staffing than waiting lists, but it's clear that more rural areas have been, based on the conversation we had in our last committee meeting, have been more impacted by staffing issues than more highly populated areas. I'm not sure if that's the case with the waiting list as well, but happy to make that request. And then, John, I'll turn it back to you as far as when we want to have a vote on the housing subsidy recommendations.
But thanks, Paul. I think that we'll go through the committee reports and then have time for discussion and present the motion. So next up is Children's Services. A number of Randy's here. We've had a whole 2 months of committees.
Yeah, hi, everybody. Randy Rios Castro. I'm co-chair with Jeff Fox. He can be here today. This is a very newly formed committee. We just met for the first time early November. We had really good representation from across the state. And our goal really was to review the purpose of the committee and the goals of the committee. We talk a lot about the number of children that are receiving services and that those numbers are growing exponentially. We review the strategic plan and the 3 objectives, assess the needs of children to understand the trends that determine the types of services that are needed, improve service coordination for children, expand crisis services, which we know there are plans to establish those services. So we're really eager to hear more about that. So some of the key discussion areas were about the 507 plan and the disconnect right now between the objectives in the 507 plan and what's currently happening in practices in children's, the administration of services for children. The fact that there are a lot of children being denied waiver eligibility and that families are pointed towards other systems and that there's a significant lack of providers. So families are basically being left to navigate those services themselves. The services aren't really, addressing the needs of the child and the whole family. The services that are available outside of the waiver don't address those full needs. So that's a big concern that we talked about. And We really stressed about the need for children with IDD to access the waiver services, particularly rehabilitation, respite, and to have access to the providers of those services, and need the proper funding for that. So we also identified better transition planning for youth, access again to the COMHAB and the respite. So if there's not enough providers because they can't get staff, the children get access to those services. The impact of the broken early intervention services, and what that's doing, because there's certainly a significant lack of providers, long waiting lists to get early intervention services. A lot of kids are not being served in schools because they just can't manage them. Better access to clinical services, which has been a huge thing, which we talked about in the wellness committee. And, I guess the biggest thing is really the impact of the workforce crisis and the ability to access the services. We have here to the microphone, Steve. So, again, this was just the first meeting. We are scheduled to meet at the end of January, and we will have OPWDD representatives at that meeting. And we're really looking forward to hearing about the progress in the strategic plan.
Thank you, Randy. Any questions for Randy? Next report will be from Darren Goldstein, Health Bugs. At our last DDAC meeting, the topic of healthcare was brought up and issues surrounding it were constantly referred to. Our committee has structure was that we have medical, dental, and behavioral health issues being discussed. A spin-off from our committee was that we have task forces, one on medical, one on dental, and potentially a whole new committee forming relative to behavioral health or a task force on behavioral health, complex behavioral health. And they're working directly with Joe Pender and OPWDD, having ongoing discussions of probably the topics that are on the minds of many of you here, including operating room, et cetera, et cetera, et cetera. Since they're working on it, it's hard for us as an advisory group, as a healthcare group, to say we're going to make additional recommendations because they're working on the items actively. And I've always felt that if they're working on them actively, then we can't make a recommendation to work on it actively. But things fall through the cracks. And so some of the items that our Health and Wellness Committee will probably want to make recommendations surrounding are, for example, it's one thing to say to a person who has a toothache or a gallbladder problem, okay, we're working on it, and you'll get services to, when it's fixed a year and a half down the road, if there's truly a fix. Maybe we need a recommendation for immediate help for people that do have access so that they can go to somebody for access and make it happen, okay? And right now, some of our task forces try and do that in an ad hoc way. We go ahead and make calls to say if somebody puts out a notice that somebody needs an operating room situation, we'll call up somebody in that location and try and see if they can arrange those services. So the other topic of concern is the future. What is healthcare going to look like for people with IDD down the road? And Kate Marley actually met with us was it yesterday, Kate? I think yesterday, to talk about what's being thought about in terms of future models. And I think that our healthcare committee should be well educated on what's being discussed so that we can make informed recommendations regarding future models, using experience to see what might work and might not work. And so I would like to encourage anyone here to get involved in the conversations, to come to as many of the meetings as they like. I'm also looking for a co-chair, somebody with a passion towards these topics. You don't have to be an expert in medicine or dental, but have an interest to kind of help us push forward the multiple agendas and prevent things from falling through the cracks so we can make meaningful recommendations. And if anybody here at these meetings wants to just bring up a topic, I'd be more than happy to address it with them, tell them where we stand on it. And maybe we should devote one full session or at least an hour at an advisory group, and I can bring in our chairs of our medical task force and dental task force to behavioral health people to stand and listen and tell you exactly what's being worked on and what the current status is. Thank you, Gary. Any questions for Gary?
Yes, it's not a question, it's Missy Miller in Long Island. I just think another point that I think is important to mention, there's no avenue currently for an urgent need. If somebody has an urgent need for equipment or for a staff or for, whether it be medical, dental, currently through OPWDD, there's just no real effective avenue to get an urgent need met. Everything goes through so much red tape, and people can't wait most of the time when this kind of a need pops up. So I think that's also something that we should be actively working on.
I agree. And Tom, you had a question?
Yes, which of our
You need to
committees,
get into your mic, Tom.
which of our committees is looking at managed care? Is it this committee?
This committee will look at managed care relative to healthcare is what we're trying to do. What's the healthcare model? When we talk about managed care, I keep hearing things about managing all other aspects of life, for people with disabilities. But in terms of the actual healthcare, managed care, healthcare, I believe there's a lot of expertise in our groups who understand some of these models. We have adopted Timothy Basilio, who's actually has quite a bit of expertise, and I'm trying to get her more involved in understanding the intricacies of the various models and presenting them to us so we can have a better understanding of what's being offered.
But are you working with the departments, the agency, in its studies of managed care?
We would bring, if they have those, we'd like to bring those to hear about it, but not directly. I have not directly.
Because we hear a lot about the studies that we.
On the subject of managed care, the systems committee is sort of the overall committee to look at that, but we also had a presentation from consulting Lighthouse on managed care that's provided to the both the executive committee and the full council. So I'll share that material with you. And perhaps what's the other someone comment on how their particular aspect of their particular committee is involved in the discussion. And I think our focus, at least mine, would be who's taking risk for what in managed care, how that works from the point of view of medical and dental services in particular.
Just ask a quick question, Gary. I would love to. Yeah, can you hear me? Gary, I would love to join your committee as well. Teresa Hamlin, I don't know how you join committees because it's my first meeting, but I also would like to be part of the children's. But just two things as well. I'm assuming that you're looking at pharmacy as well, and polypharmacy and foster pharmacy. Because I know that's a real challenge, especially for kids that have the mental health issues as well. And then is there some thought about really training up hospital staff, especially ER staff, to manage kids with really complex behaviors in particular, like kids with autism, and even the really complex medical as well, we're just woefully under-trained in how to support individuals. So, but anyway, it's something I guess that the community talks about.
Yes, the training issue was brought up several times. The polypharmacy was brought up in the past, but is not necessarily a particular focus and should be. So I think that's something to bring up and have our medical group perhaps pick that, decide where they want to focus in on that. At one point, polypharmacy relative to adverse incidents was an issue I actually looked into when I first started here 20 years ago in this group, and some death issues related to certain polypharmacy items. So yes, I think it should be good. Gary, we talked about this a little bit before, with the changes after the pandemic. You reviewed the implementation of telehealth and also telemedicine. The feeling, we brought that up, and the feeling was that telemedicine is here. And that it's, to the extent that they feel, the committee felt, in this preliminary discussion, is that telehealth is now accepted. And so it is being utilized. If there's more comment about that, if it's perhaps can be pushed to a higher level, let's talk about it and see if, what else can be done, what's being done today. But we did bring that up at one point, and it didn't get that much attention from the group, other than saying, yeah, we have that. What is, what are we missing in terms of the next level? Thank you. Anything further for health and wellness, Smith? So I know Susan and Shanika are on, but they're in different places. And either or both of you want to report on employment and meaningful activities committee. Shanika and Susan co-chairs.
Yes, I'm gonna start the rollout, and then if Susan has anything to add, she can do that too. Thank you. This is the. I'm sorry. Did somebody say something? Okay, I thought I was hearing things. All right, so this first slide is just our current list of members. We've added since the last meeting. Well, I don't know. I don't remember if there were members the last meeting. Jeff Fox and Lucille Rossi. Lucille has been a great help to the committee with doing a lot of administrative stuff and things behind the scenes. So both great additions to the committee. We're still working on, attendance and things for, meetings, which is, improving. But it's still a concern as far as attendance. But we'll continue to work on it. Next slide. All right, so things that we're currently discussing. Number one, creating a vision statement for the work of the committee, which better aligns to the activities that OPWDD is working on. So we're working with Allison and Julia, have both been attending our meetings. So we're kind of working together with them. What's their vision? What's our vision? And kind of working together to make sure that those things align. Ensuring that day programs provides measurable opportunities for participants for meaningful outcomes, really looking at what's happening in day programs now, and, how can we improve that? The importance of knowledge of incentives and benefits, benefits to employment, continues to be a barrier. People not having the education and knowledge about, what are the things that will support them to go to work. They're often told that, if they work, then they lose their benefits. But there's lots of, things that can help people increase their income and keep their benefits. So just really working on with OPW and other entities to make sure that people are aware of this. The last area of discussion is the data. Suggests that there's a limited number of people in employment programs. So really finding out where people are, and what the data says. And are they being successful? If not, what do we need to do to help them and support them? So areas of concern: lack of data, lack of communication and collaboration between the employment, our committee and OPWDD staff. As I said, that I think this is slowly turning around, with Allison and Julia involved. Lack of employment transition plans for people leaving pre-voc, I think this continues to be an issue of people not transitioning or people being in pre-voc programs for 10, 20 years or more. So really looking at how are we helping people transition that can transition, and make these programs what they're supposed to be, and also, the limited opportunities for vocational activities within day programs, are the things that people are focusing on leading to, job skills and things that will help them get a job. So, Susan, do you have anything to add to that?
Thanks, Shamika. Can you hear me?
I can.
Good. We're not always sure about the technology here in Buffalo. I do want to thank, as you already did, Allison McCarthy and Julia Kelly for being included in our committee and for the work that they've done and continue to do for employment. We've seen a real uptick in employment activities and getting outside funding, which means a lot in terms of improving services. And I also want to talk about the importance of data. We know there are a number of employment programs out there, but what we don't know is how successful they are. So that, as Shamika said, is really one of our major concerns. I also want to thank Lucille Rossi for the work she's been doing on our committee. Thank you.
All right. I think that's it for us, unless people have questions.
Thank you, Susan. I know the commissioner has some comments she was made.
I just wanted to take a minute to add a couple things that OPWDD is working on related to this specific. And as Susan mentioned, there's a lot of activity at the agency around employment opportunities for people with disabilities. And we're really grateful for the collaboration with this committee of the DDAC, because it's increasingly a priority of the agency, because it's increasingly a priority of people with disabilities, developmental disabilities, to have meaningful employment opportunities and meaningful community engagement. So just a couple of things I wanted to mention that the team is working on, and we have an incredible team working on employment and meaningful community activities. We recently announced a vocational and technical assistance training grants to providers across the state. So 8 providers across the state have received funding from OPWDD to provide vocational training for people with developmental disabilities. So this is different from the habilitative services that we provide for the Medicaid program. These are real technical skills that people need in order to be competitive in the workplace environment, and providing those opportunities for training for people who are seeking employment. We're very excited about that. So we have every region of the state is covered, and some of the regions have multiple providers providing this vocational training. We're also continuing to work. We benefited over the summer from technical assistance from the U.S. Department of Labor, and we have another opportunity to receive technical assistance from the U.S. Department of Labor in collaboration with the governor's chief disability officer, Kim Hill, State Department of Labor, OMH, and Civil Service. Again, with the area of focus being how to increase employment opportunities for people with all types of disabilities. And OPWDD has been the lead agency on both of these technical assistance grants. And we're working to bring the information that we're learning from US DOL and other states, bringing it to bear here in New York State. We're very excited about that as well. We'll also be releasing some updates to our SEMP regulations, our supported employment program regulations soon that will make it easier for people to access supported employment services, and we're very excited about that. A non-OPWDD activity, but wanted to make a mention of, is that the Chief Disability Officer, Kim Hill, in the Governor's Office is working primarily right now in New York City on inclusive internships. So it's a program that New York City government has been running a lot, providing inclusive internships for people with disabilities within New York City government. The Chief Disability Officer is working on standing that up within New York State government. Again, like I said, primarily in New York City to start, but with the hope of being able to expand. And so as there's more information about that, we'll bring that and provide that here. And I just wanted to echo what Shanika and Susan both mentioned in terms of prioritizing data and the needs of data specifically in this area, and really trying to understand the impact of the services that we're providing and the outcomes for people with developmental disabilities, and the outcomes being employment, are people being successfully employed, are people able to maintain employment, and how are our services helping to benefit that. And so that's an area of focus for the agency. You see it reflected in our strategic plan, and it will certainly be a topic of conversation at the DDAC community of practice. So thanks, just wanted to put in a flag for all those activities.
Thank you, Commissioner.
I'd just like to make an additional statement. Thank you, Commissioner. I'd just like to make an additional statement. You know, we have limited, what opportunities do we have after people have done a pre-vocational program into the job market? I think we need to start changing it to people of determination to work, not people with a disability and trying to find them a place. If you've done pre-vocational activity, you've done pre-vocational, you are now determined. You want that job. So that's what I think we need to change the mindset of getting people jobs to now you've gone pre-vocate to person of determination, a job determination. So I just, my 2 cents, because we don't seem to have much data, and we don't seem to know what happens to individuals after these pre-vocational programs. Who's getting a job, how are they getting a job, and are they keeping these jobs? You know, the agencies do a lot of the pre-vocational programs, they do all of this, and then what happens afterwards? What happens after somebody does access VR, contracts with an agency to do some kind of pre-voc program, and then the access VR program is closed out? What happens to this whole circle of job development? Where does the individual go, down and out, or are they determined and they have a self-determination, or do they have a determination to get a job, or what do they have? Who's getting them on that track? All right, that's it. Thank you.
Thank you, Karen. One thing to add to what the Commissioner said, creating benefit optimization is vital for folks who are in the labor force, and the New York State Department of Labor has created, I think, 27 career centers with disability resource coordinators or benefit advisors who've gone through either the Cornell course or the Virginia Commonwealth course, and so they are genuinely qualified rather than just anecdotally qualified. And we can obviously provide information on that, but if you outreach to New York State Department of Labor, I can get connected. It's a really good resource for benefit advice.
John, this is Paul Goodall from Syracuse. Can I just add something as well? To Jerry's point, which is a very good one, that we need to have passed for people who are ready and interested in employment. Access CNY, the organization I'm lucky enough to work for, was one of the beneficiaries of the career-specific vocational training that the Commissioner mentioned. And I just wanted to mention that we just had our first graduation last week from our first class. 3 individuals who now have the skills and the confidence to go out and find competitive employment. So I do think that demonstration project, if you will, is one of the ways OPWDD is exploring how we can better help with that transition you just described, Gary.
Success stories. Stephanie had a question.
Okay, when I was just got out of school, I didn't have an agency that helped me. So I found all my jobs on my own. I worked at McDonald's from 1992 to 96. Then I found a job at the Polish Villa. I worked there. I was a dishwasher. And then I worked at Anderson's. But the agencies didn't help me. So I found all 3 jobs on my own.
Nicely done. Thank you, Stephanie. Randy.
I was just gonna comment about the disability resource coordinator, because we have a unique situation at Joanio where we have the DRC that is actually employed by Joanio, but works with the Workforce Development Board and BOCES, and I'm happy to volunteer him or tell him that he can connect with you to help, address the issues of the concerns surrounding individuals working and, how they can work and still get their benefits, which is really important because a lot of people don't understand that.
Thank you, Randy. We can have that in the minutes. I'll take her. I think, Kristen.
Thanks, John. I just wanted to raise that people are not aware, and certainly I know that Shamika is aware since she is one of the CDD council members and our caucus chair. But the CDD is doing some work in the employment space as well. There is an apprentice project that's underway with the Strong Center for Developmental Disabilities at the University of Rochester. And that, to the point that someone made about, what's the connectivity once someone's trained to actual employment, that is a direct connection, getting people into apprentice programs and then working with the Manufacturers Association of Central New York to plug them into companies that are ready, willing, and begging to hire people who have the appropriate training. So these are apprentice programs. And then we also have a project underway, and I think Shamika actually has taken some of the offerings in this. It's an entrepreneurship program where individuals can take various modules to try to start or grow their own small businesses. So we're going to do more in this space as well.
Kristen reminded me of one more thing that I forgot is our employability program and working with the legislature who passed a bill in the governor's time. We have an employability program for businesses to take apply if they're interested and committed to inclusive workplaces. And this year we launched a training program for those businesses. We've already trained over 150 businesses across the state who have taken a pledge of becoming an inclusive workplace and creating inclusive environments. And that training consists of lots of information for businesses of how they can become more inclusive, how they can support employees with various disabilities. It has information on tax credits, information on our programs so that they understand how their employees can be supported. And it's been very successful so far. We'll be looking to promote that as well with business council and chambers across the state.
Tommy,
Yeah, well, a couple of comments. First of all, I was wondering why you hadn't mentioned employability. I did see your, I'm familiar with the legislation, Ms. Berg's legislation, and I did see your online presentation. I would commend to you to take a look at Autism Speaks online presentation as well. And what I think we need to look at is the second step. You were talking about reaching out to businesses, training them, et cetera, which I think is a good first step. The second step is to concentrate on getting people jobs, not just training. I think there's a lot of discussion about training, but in many of the cases, we're dealing with people who need on-job training, not theoretical training. You're dealing with the people that Access VR deals with, which is basically those people who can be independent after a few months of training. That's one group of people. But my experience has been there's a large group of people who will not be independent, but who want to work, that are capable of working. Giving them theoretical training doesn't work. They need on-the-job training. And if you listen to the Cornell people and the others in this field, they talk in terms of not interviewing a possible employee, but auditioning for them, see if they can perform the tasks. And you guys have gone into all of the Cornell stuff and also know what I'm talking about as you break down the jobs, et cetera. So I think the second piece, it's time to do the second piece, which is to try to match people with disabilities with jobs. And I want to suggest a few techniques in that area. One is, since jobs are local, yes, we need the statewide policies, we need local partners. And I want to suggest that we go back to something we abandoned a long time ago, which is using the counties. They are there. They have people pushing them to help, but they don't have any leadership, any guidance on what to do. So they could be partners in helping find jobs for people, helping to find jobs for people, and dealing with local employer organizations, et cetera. Secondly, I think we need to take a look, and I suggest this to our committee, at the restrictions on staff, people funded by OPWDD. They are not permitted to be job coaches. So therefore, they can drive somebody to a job and they can pick them up afterwards. But my understanding is they really can't be of assistance during the day. So now I don't want to get into the whole thing, but anyway, I think that's something the employment committee can take a look at, and I'd be glad to discuss it with you. And thirdly, I think we have to recognize that there are some people out there just cannot be competitive, cannot work in the competitive market. And there's this push right now in the legislature and elsewhere to do away with the sub-minimum wage. I think we really need to take a good look at, is there a place for a sub-minimum wage operation? It's very restricted in New York state law. If only certain entities can do it, they have to be licensed by the Department of Labor. And maybe OPWDD wants to take a look and see, is there a place for this? And can we use it? Can we direct some of our people into those types of operations and make it even broader rather than the narrow operation is now? Go in the opposite direction from the political pressure that we have out there. So those would be my suggestions to the employment committee, and I'd be glad to, I'm working with Westchester County myself right now, trying to get Westchester County involved in helping people get jobs. So I think you can do this in every county.
Thanks, Tom. Is there one more? Sorry, Danny.
That's okay. So just to echo what Tom said, I completely agree that if we don't get a handle on that, it can never be a one size fits all. Because we have a lot of people who are going to fall through those cracks and not be able to do it. And that's one piece of it is pushing back on some of the pressures and rhetoric that everybody can do certain things when, as parents, as providers, we know that's not the real case in some people's lives. The other piece that I just wanted to mention is CAP represents both the workers at Access VR as well as the Rehabilitation and Vocational Counselor Series. And a lot of the ways they are used, particularly in OPW over the last 10, 12, 15 years, has changed. And I think we might want to have a conversation, or the employment committee might want to have a conversation about looking at how these folks are utilized, because they are truly trained and skilled in developing employment skills. That is the focus of their education. But we have, because of, transfer rights and other things, we have people that come into those titles that don't have that skill set or are not as equipped to do it. And the agency has used that title in different functional ways. And I think maybe we need to get back to looking at it. The Access VR piece is what it is. They do the assessment. They are not going to walk people through every step of their workday. But we do have people that can do that and should be doing that, and I would just suggest that we look at how that function is being utilized in OPW, particularly the rehabilitation council function.
John,
Yeah, go ahead, Susan.
I want to thank everyone for all of these good thoughts and good information, and suggest to you that you either serve on the committee or are willing to provide information. There's one thing that our committee has talked about after these slides were developed, and that was the need for customized employment in New York State. One of the things we've noted is that other states have higher rates of employment because they use customized employment to a very successful end. And I think we better leave employment now so that we can get on with the agenda.
Thank you, Susan. And we're going to move next to Stuart on self-direction.
Thank you, John.
And we'll keep it within the time span if you can, Stuart. Thank you.
No, absolutely. But first I have to do some quick housekeeping on our committee. It was brought to my attention that I continue to leave somebody off of here who was a very important subject expert for us on our committee, and that is Gail Pardo. And she has participated in virtually all of our meetings, and Gail is heading one of our subcommittees. I also wanted to let you know that Tom Abenati has joined our self-direction committee as of just a couple of days ago, so he's not on here, so I'm very excited about that. And those are the two housekeeping issues, and Marietta Austin is the third housekeeping issue. She is co-chair, and so I see she's up there as co-chair, so that is terrific. All right, so our committee is working with, has created two subgroups or subcommittees, and we continue to work within those subcommittees. One is sustainability and equity, and one is the self-advocate survey. The one that I'm going to talk about first is going to be the sustainability and equity committee. What we have been discussing is that there does not appear any consistent and universally accepted rules and regulations and guidelines that are accepted by families, brokers, care managers, and fiscal intermediaries. And so what we end up with is quite a bit of argument in the community over why something is not covered, why something is covered, and why people are having trouble getting the services that they want through self-direction. So that has led us to talk about a community of practice, as has been spoken frequently at OPW. And our goal is to align and incorporate brokers, fiscal intermediaries, care managers, recipients, and designees, so that there's a common understanding of what can be done in self-direction. We also understand that this community of practice may have to be regionalized, but we also want to consider whether or not there can be a statewide single rule rather than looking at regional community of practices. The diversity and equity part is very difficult to address, particularly when you have so many different people interpreting guidelines, and certainly people who have language challenges or cultural differences are going to have a very hard time fitting into standard self-direction practices. We're also concerned, and we want to see more enhanced learning and study by care coordinators. We feel that they don't have the necessary skills and knowledge to assist a large group of people who are definitely moving towards self-direction. And then we'd like to see more measurable standards for fiscal intermediaries, support brokers, care managers, and service recipients in their community of practice so that results and operations can be more closely monitored and people can make a choice. The last thing that I'd like to address is that our committee is still very concerned about the RFP on self-direction. I understand that we're closer to an award, but it has been some time, and we are concerned that that's going to change some of the discussion within our group. And then the second thing I'd like to ask is that the Guidehouse, which is the group that's doing the study for managed care, really needs to include needs to have self-directed folks participating in discussions. We feel that not having us at that particular table is leaving out a problem that's going to come back to create quite a bit more dialogue in the end. And that's our report. Thank you, John.
Any questions, Stuart?
How do, if you want to be on a committee, both Lynn and I would like to be on this committee.
Can you say who you are, please? I can't see who else. Oh, it's
Missy Miller, we're on the Long Island page.
Sure.
Lynn, what's your last name?
Koufakis.
Lynn Koufakis and Missy Miller would like to be on this committee.
Thank you.
That's terrific.
This is Debbie McGinnis. Can I jump in for 1 second?
Debbie.
Thanks, John. Under key concerns, I just wanted to list for the minutes that, and I believe OPWDD is taking a look at this, but again, just to document this, that a lot of budgets that are being approved for FIs, that obviously most people's budgets include pieces of it that are funded by state dollars, that there needs to be some checks and balances in place on the OPWDD side, so that OPWDD has its own gatekeeper in terms of budgets that they are approving for a particular FI, that if in fact they're approving budgets for a particular FI that exceeds what their grant dollars are, to even cover the costs associated with those budgets specific to the state dollar portions, that there be a checkpoint on OPWDD side so that approvals are not given way beyond what can be funded. I think there's a fair share of FIs throughout New York State who have found themselves in a position where they've received a lot of approvals. They've been encouraged to grow, they've done so, and then in fact, they need additional grant dollars that may not be available to the level that they need. And then where does that leave them other than needing to tell people we can't fully fund your budget, so we're not sure we can continue as your FI. So I just wanted to bring that up as a key concern, and I'm hoping that OPWDD, and again, I do believe they're taking a look at this, but I would strongly encourage that to be a careful look that results in some needed change.
Thank you, Debbie.
I think Debbie knows, as she noted, that this is something that we're looking at already. Yeah.
Yep. And
Any further questions? Can you explain that issue further? I'm not quite sure what.
Sure, I can explain. So I think folks know that when we contract with fiscal intermediaries, there is a state-only dollar portion of a person's self-direction budget that you can't really determine upfront, right? Because it's dependent upon the development of the budget, how much is utilized throughout the year. Things change, there are budget amendments. But as you know, right, it's a contracting mechanism. It goes through the Office of the State Comptroller. It's authorized every year by appropriation legislation. So we have a maximum amount that we can contract for. It needs to go through the Office of the State Comptroller. Every contract is approved by them and by the Attorney General, which is our contracting process in the state. And we can't exceed the appropriated amount. But what happens is we take a guess at the beginning of a 5-year contract period, how much of the state-only dollars each FI might spend, dependent upon how many people they are supporting through self-direction, how many dollars get spent through that person's self-direction budget. And as I said, that changes. FIs have new people come on, people drop off. So it's always changing, which makes it very difficult to contract for the state-only dollar piece. So we have to repeatedly go back to the state comptroller to ask for contract amendments, which the state comptroller doesn't necessarily like, because to them that signals that there was an issue at the beginning, right? If we can't sort of get figure out the exact dollar amount that we need to contract for, they don't like to make repeated, contract amendments. And as you know, we contract with many FIs across the state. So that's the issue that Deb is highlighting. We do have internal checks and balances to make sure that we're staying within our appropriated and contractual amounts, but it can be a little bit challenging as FIs grow. Some FIs grow at different rates, some don't grow. Some FIs, some FIs do better than others. Word of mouth spreads. People want to go with this FI, so they grow from 50 to 200 over the course of a 5-year contract period. That's going to drastically change the amount of money that they need to be in.
Is this money that goes to the FIs? Is this money that goes to the FIs, or is this money that goes to the?
It goes through the FI, as all money does, goes through the fiscal intermediary to the individual.
In the beginning, how much money to allocate in that budget for that purpose?
It's partially a guess based on the individual's need, based on their startup budget, what they're expressing that they want to do with their self-direction budget, and that changes. And I don't know, Gail, if you want to add anything, you're nodding your head, so I feel like I'm saying the right things. But it's a guesstimate based on, what a person expresses they want to do with their self-direction budget, and it changes as they go. And we leave room for that in the contract, but as an FI expands and they're supporting more and more people, or as people max out their self-direction budgets, that's where we start to see some of that tension with the budget. And we need to be monitoring our own liability, because we, like I said, right, we're appropriated for a certain amount and we're under contract for a certain amount that's been approved by OSC. Monitoring that across multiple FIs is sort of where the challenge comes in. So we're looking at other contracting mechanisms to make that a little bit more manageable for our teams and for the FIs, so that people who are self-directing their services know reliably that that money will be there. And so I just want to also mention that nobody has been told that they can't spend their self-direction budget because of this issue. It's an administrative burden for us and for the FIs that we need to figure out, but there's nobody who is self-directing their services who's been told, you have to stop spending money because of this. People's self-direction budgets are there for them to spend. It's an administrative issue.
Isn't the state amount a small portion of the full amount? I was under the impression the state dollars were a minimum part of the regular budget for the normal plan.
Yeah, I don't really know the breakdown of it. That's just sort of that's the administrative issue that Deb is highlighting.
Thank you, Terry. So going to move to the Systems Quality Data and Service Delivery Committee. And Dolores is not able to be with us today, and she's asked if any of the other committee members are there. She can give information for them to transmit. Otherwise, I can read what she's asked me to say.
Yeah, John, it's Michael Seawriter. I volunteered to try and pinch hit for Dolores here while she's traveling.
Go ahead, Michael.
So the Systems Committee has had a few really great, robust conversations over the past couple of months here, really focusing on trying to, I think, rebuild the committee in some ways. And in doing so in a way that is really trying to build a more collaborative type of relationship with OPWDD, and our conversations with the Office of Strategic Initiatives, Allison and Jess, have been particularly constructive and refreshing in that regard. The committee conversations have really focused on what the scope of work is, if you will, for the committee. And really, the conversations have gravitated around something that's more long-term in vision, rather than the more pressing, immediate issues that are facing the system. That's not to say that the committee is not going to be looking at those more immediate issues, because they're they're indicative of the challenges that the system has and that it's facing. And that includes, I think, some discussion and some look at the issue of managed care, which was raised before, but the committee also felt pretty strongly that the exploration of managed care, which is ongoing with OPWDD right now, should not be wholly driving, if you will, the committee's work. One of the main areas of focus, which I've heard several times mentioned today, is the challenges around data. This is a committee that should be having a long-term vision and a long-term focus down the road, and it's very difficult to get any vision on that when we don't have data or good data sets that help inform where the system has been and where maybe provide indications where it is going. And so to that end, the committee is looking to establish a standing committee, if you will, really being a home, if you will, for the data community of practice that has been talked about and discussed with OPWDD over several months, I think more than a year now, actually, as a bit of a standing committee to serve as a place for this dialogue about what the future of data and the data initiatives should look like to help inform the system level conversations that are taking place, really focusing on transparency, a bidirectional exchange of data where that's feasible, and building a collective understanding amongst all stakeholders in the system about what the data that is available can tell us about where we are. The community of practice, I think, is envisioned to have a role where it will serve as a venue, for lack of a better way to put it, for data sharing between OPWDD and across OPWDD and providers, CCOs, families, advocates, self-advocates, and others and other stakeholders in the system, really focusing on that transparency and collective understanding issue. This should also be serving as an opportunity for stakeholder feedback on how OPWDD shares data. I expect that the conversations around the data of community practice will be very much forward-looking. So it will be a bidirectional exchange of information so that we are informing what data and what those priority areas might be in terms of data build-outs and data reporting in the future. There's a lot of work underway at OPWDD to build infrastructure. We recognize that OPWDD is probably decades behind in its ability to collect data and use that data as a predictor of where the system is going. We want to help inform that process using the data community of practice. And lastly, I would just say that, some of the key concerns I think they're articulated on the screen here really in some ways stem from, I think, some challenges in the relationship that this committee and the previous members of this, the more longstanding members of this committee have had with OPWDD, and a frustration over recommendations that have gone forward to OPWDD in previous years that have not seemed to get much of an audience. We will be relooking at some of those recommendations of previous years, looking at how those align with the priorities that have been articulated in the 507 plan, discussing with OPWDD how we may be able to help advise in the sequencing of the priorities and timelines associated with those priorities as well. And one of the things that I think is suggestive of some of the work that we're doing from more of a foundational perspective is that there's also a discussion taking place about the words that we use and what we mean by those words. And I think that there is a belief and probably some recognition that when we use words like person-centered and choice, that we may have different views and different definitions of those words. And part of the alignment process is going to be getting on the same page and what those terms of art mean in our system and what we really mean about where we want to see those terms of art used to drive our system going forward. So more work clearly to come, but it's kind of exciting to be at the beginning of a process, particularly in the use of in the efforts to try to collect data and advise in the collection of data in such a way that will help us determine where the system may be headed and help to steer that in the future.
Thank you, Michael. Any questions, any comments? Thanks again, and we're going to move to Gail from Family Support Services.
Thank you. Family Support Services is a committee that's comprised of one
member from each regional family support services council across the state. So that comprises the membership of this group. This group kind of restructured several months ago to ensure that our work was moving forward and we were becoming more productive and collaborative with OPWDD. And we divided into 5 subcommittees. One of them was around bylaws. They've been very successful in getting bylaws updated and for some areas drafted and put into place. We've collected those so that we have them available, and that has been successful so far. Also, we have a committee coming together for a new RFP process, hoping to get some of the dollars that have been distributed out into out to families in all of our communities throughout the state. Part of that RFP process is really coming up with a needs assessment tool that will be helpful for stakeholders across the state as they embark on this process. Another area of focus is on the ADM that was released around family support services reimbursement last July. There was an ever-growing non-allowable list that many people felt was not necessarily considering all of the individuals that had needs. And so we've collected some data from around the state and we have presented back to OPWDD for reconsideration for the allowable list. And we're hoping to hear back on that soon. We consider that great progress that that's being reviewed and considered. We also have a stakeholder engagement group that's been working very successfully to create a membership brochure to help with recruitment of new family members to get involved and be a part of the voice that helps OPWDD get the services that people need. And they're also working with some of the regional councils across the state. COVID was definitely a huge impact on that membership. And it needs to be rebuilt. In some areas, there is maybe only one member. So that group's been working on helping councils consolidate if needed, kind of get mentor councils to help them get back on their feet and developing new partnerships to help those councils become more productive in their areas across the state. So that's an update from FSS.
Thank you, Gail. Any questions or comments for Gail?
And the next meeting is actually Thursday. November 3rd.
Randy, can you join?
If somebody was interested in joining their local council, would they go to the FSS manager at that DDRO or is that?
Yeah, there's an FSS coordinator at each DDRO that would take the contact information and connect it to a family member, and we would love more membership.
Thank you to all the committee chairs and all the committee members. And that concludes the section on committee reports. We do have one motion that emerged from there, and we need a motion from, and I'm going to ask Paul to make a motion to approve the recommendations from the residential committee.
So I make that motion, John.
We need a second.
I'll second, John.
That's Dan Brown seconding. All in favor, notify by saying aye.
Aye.
Any opposed? Motion carries. Thank you. I'm going to pass on to Nick.
Thanks, John. Rachel, can we advance the slide? We just want to note that there are some outstanding recommendations and concerns that have been previously expressed by the committees through the council and will be each will be up with the OPWDD liaison to follow up on the status of those, and we'll report those out in future meetings. But if there is any update, I know Stuart, you all discussed a couple of them from the Self-Direction Committee, and I know systems have a few issues, and Gary, the health and wellness, have talked about the medical rate design. Those are the ones that we are aware of from the. Okay. All right, Rachel, could you advance? And again, listening to the committees, all the good work that is happening at the committee level, we again encourage, and I know some of you have already volunteered to participate in some of the committees that we have, but again, we would encourage that participation because that is where most of the work is done. Rachel, could you advance? We do have a few minutes to open the discussion of the council on any new business, new issues, new matters that they would like to bring up. I'll just, and for those remote sites, if you could please verbally identify if you have a question or comment.
Maybe Nick, if we can go around the table, start with all the questions.
I'd just like to make a comment from Long Island.
I'm afraid you come last year.
Hello?
Anybody in Buffalo?
Did he not hear you?
Hello? Can you hear?
He's going by region. Is that what he's doing?
Region 1 in Buffalo, anyways.
We're good. We have no comments other than what has been talked about.
Thank you. And region 2 with Nick and Paul.
No comments here.
Okay, in forward region 3. I wish to add or discuss any extra business, new business. Region 4, Stuart. Going back, Tom has a question here in region 3.
Yes, so what's the process to get a response? I mean, we just passed a residential committee recommendation, which is quite well substantiated. Will we sometime in the future get a response to this?
We'll review it, with multiple divisions within the agency, and we'll have a response for the council. When our council meets.
Yeah, I would add in this particular regard, I know Paul mentioned it, but we have a lot of collaboration between the strategic initiatives and programs living, but having developed these give a lot of feedback from the state as well. So some of them are sort of halfway being implemented forward. The Stuart, region 4.
Nothing in region 4.
And to the folks in region 5.
I'd just like to make a comment. The family services and supports on Long Island here, that we're up and running very well. We just had our annual breakfast since COVID, very well attended, 50 years since Willowbrook, let's not go back, and it was attended by almost 450 people. So we are getting a lot of activity here on Long Island, and we're hoping that the 507 plan and everything that OPWDD is proposing and what these committees are proposing will work to the advantage of our individuals, one sitting right here, to help them in the future as to person-centered planning. Thank you.
Good job.
Thanks, Jerry. Any further comments? Back to you, Nick.
Thanks, John. Okay, now we're going to move to public comment. You can advance the slide. Given this, I'll ask Rachel to moderate this section because we do have, I believe we have one member of the public, at least at one location, as well as members participating virtually. We'd like to ask members of the public to limit their comment to 3 minutes. If you have a longer question or comment, we also welcome you to send it to the OPWDD information box, which is info@opwdd.ny.gov. if we run out of time, again, that is another way to submit your comments, and we will review them prior to the next meeting. So Rachel, can we open it up to public comment?
Absolutely. So we have one person in Albany who does not want to comment. Is there any members of the public out in Buffalo?
There is not. I'm sorry for the delay. I always have to unmute the button, but no people in Buffalo in the conference room.
Okay. Anyone in Syracuse?
No.
Okay. Anyone in New York City?
No.
Anyone in Long Island? Long Island, if you spoke up, I didn't hear you. Okay. So we'll turn over to the folks that are online. If you would like to make a comment, please click the raise your hand button. It is down on the bottom of your screen. Remember, you've done that, so I'll call on you and you will get a notification to unmute. The first person up is Trish Calandra. And you should be able to unmute.
Can you hear me?
We can, yeah.
Okay, great. Thank you so much. I'm actually have a question in regards to the ARPA funding that was for certified and non-certified supported integrated housing plans. We were awarded $20 million from the federal government to explore these things. The ARPA was released in 2021, and then certified was finally awarded in August of 23 after it was due in July of 2022. And we have nothing in sight for the non-certified opportunities to get creative, and I'd hate to see that money go away. So I'm wondering if there's anything happening with that. As well as the new Section 811 funding that was proposed by HUD. We have not had that funding for people with disabilities only since 2011. And that's a great way to also increase the availability of funding for rental subsidies, as well as some capital and rental subsidies. So I'm imploring OPWDD to align with that and submit for that funding. But hopefully someone could answer me about the ARPA funds.
Thanks, for your comment, Trish. So I think this is Carrie, as you know, we issued the award to, I think, 16 providers on the certified housing side and 15 or 16 providers. We are starting our community of practice with those providers next week to begin to discuss the work that they're doing and socialize that across the state and understand what's working, what's not working. Obviously, it's early for them after the award was made with the contracting process, and so they're really at the beginning of their work. We're not at risk of losing any of our ARPA dollars. Our ARPA dollars are being spent, and we are continuing to earmark money to invest in innovation grants so that we can continue to support the non-certified housing work that we said we would as part of our ARPA plan. And we've been public about all of this, so there's not risk of losing the ARPA funds, so I don't want folks to worry about that. And the delay on the spend was intentional because, as you know, there were a lot of moving parts, a lot of activities happening as these ARPA dollars were available to the states. The states were also dealing with the pandemic that made the ARPA dollars available to them. Our providers have been overwhelmed with the workforce bonuses, the grant opportunities, managing the workforce crisis. And so in collaboration with the providers and with the community, wanted to make sure that we're spending the money on a timeline that's responsible, so that we're actually allowing providers the opportunity to take the dollars that they're being awarded, invest them in the ways that they're suggesting that they want to invest. We can study the effects of that and not rushing to get dollars out the door on a specific timeline, and not, not seeing as much, impact from that. So like I said, the delay on the spending, for the rest of the funds that for the rest of the grant opportunities was intentional. But that does not mean that the money is going away, and neither will the opportunities go away.
Mr. Chairman, can we follow up on that question? I have a question to the commissioner. Is there anything in the requirements of the ARPA dollars that they be given to providers and not to individuals? It sounds like you're wanting to give the non-certified monies only to providers. I think the thrust of, I think many people out there would be looking for those dollars to be spent through, let's say, self-direction or through some other program rather than voluntary providers.
The non-certified program hasn't been designed or developed yet, so there has not been a pathway articulated, but even if we were going to spend the dollars for folks in self-direction, so if we're talking about through something like a creative housing subsidy or something like that, that would all go through the provider, right? There's a housing subsidy provider, who those funds are allocated to through VFI. So all of that we would still be, doing that in relationship with our provider community. But the non-certified, right, like I said, opportunity hasn't been designed yet. And I think the intention is that we've been working with the community to understand creative models that people want to pilot, that they want to see if it works. And so we're open to hearing what those are when that opportunity is available.
Are those one-time funds or are they continuous funds?
The ARPA funds are one-time funds.
Is there anybody from OPWDD like to respond on the 811 subject? We can table that for clarity purposes. Section 811 is not dollars that are required to be co-invested between an agency, provider agency, and a developer, which require collaboration between New York State Homes and Community Renewal and OPWDD newly be brought to those other business developers and private agencies. So we'll cover that.
All right, next up, we have Steve. Steve, you should be able to unmute. Steve, if you can unmute, you can put your question or comment in the QA and I'll get it. So next up, we have Ralph Warren. Ralph, you should be able to unmute.
Get there. You guys can hear me? Okay. All right, so this is more of a process question today, and to, not to OPWDD and to the DDAC. So I would like to ask specifically, can we have a mechanism where myself and other members of the public can send in comments for each meeting so that everyone on the DDAC can see them and we'll know that. And more than that, to have them archived so that, between now, certainly this is a critical time of the year, between now and the start of the budget cycle next year, it's very important for people to see this. So there's certainly a number of people on the committee that I know that I'm on other official boards with. I can email them directly, but that's not the same as having the DDAC officially recognizing this, archiving things. Why is this important? Start with examples from other states. In one of the in the CCO advisory board I'm on that has met recently with Kim Hill, I passed on to them examples from 2 other states. Texas, going back several years, still archived video of Deloitte giving a report on their analysis of managed care. The specifics are not important now. The fact is Texas, since that time into the present, has archived meetings like this and subcommittee meetings, and it's a very good example of this work. Same thing with New Hampshire. I looked that up because currently Optimus is engaged with them on rate setting. Those discussions at the advisory committee level and subcommittee level are archived on their website. This is what is really meaningful and useful for people to affect legislation and public policy. And I hope that you guys would make those mechanisms available to us. The last thing I'll say about the disappointment, I mean, I was happy in my Guidehouse town hall. They were very responsive to things I raised and other people, but we're not able to see actually, if we get a summary that is, advocates over the years have known that these summaries are not the same as seeing the actual comments where you can extract people's identifiers, but the importance is to see all that information archived so that when we go to the legislature at the beginning of in January, we can reference these things. So I hope the committee considers these ideas and that we can have a mechanism to make this happen. Thank you.
Thank you, Ralph. We have begun actually to archive all committee meetings, subcommittee meeting minutes, and Sumantra's been developing that for us. So we now have those for the last period of time, but we also have live stream recordings of all of the council meetings going back some years. I don't know how exactly work. I think back to 2019. But that material is available. I believe there's also an economic way to improve the website. So the comments are well understood, but we are needing to make some headway. Thank you.
All right, next up we have Andrea. Should have gotten a request to unmute. You're unmuted.
So I've been a dog with the bone for the last 10 years because I have a child with autism. And since he's been 14, I've been told he makes too much money in child support. 2/3 of it has to be paid down. Now that's true for if you're following SSI's rules, that is 100% correct. Child support counts because it's from the other parent. I found multiple places in the MRG, one particularly starting on page 732, which happens to be the Office of People with Developmental Disabilities, their community-based waiver. And right on that page, it says, when Medicaid eligibility is determined by waiving parental deeming, a child support referral is not pursued. So then my question would be is, well, if you're not going to pursue child support, why are you counting my child support? And the COC told me, well, it only counts when you have it. It won't count if you don't. Now, I work in health insurance, and I know that's really a mental health parity issue. And I found out that this happens to every child that gets child support in the state of New York. Child support's counted. And with the divorce rate of parents at 80% of autistic children, I could tell you my kid's not getting the benefits because I can't afford to pay down, put his money in a pool trust, open up a special needs trust. Plus, New York is now 41 out of 41 states that child support's extended until they're 26 for developmentally disabled. If you look up the definition on the Webster of parental, it's plural. So when you're waiving parental income, there's no reason the child support's still counting. Now, I know that this is going to be a gigantic change. But only kids that are getting paid child support have a stricter financial requirement than kids where parents didn't get divorced. So I'm really interested in what we could do, is because this is like my third meeting coming here, and I keep coming to big, high-level people in this organization. Nobody's really looking at this. How many kids have been either forced to open a trust or, like myself, chose not to get the benefits?
Next up, we have John. John, you're unmuted.
This thing's working, right?
It's working, yeah.
All right, perfect. I'm using a phone, saying my phone's not that great with connection. Well, anyway, I mean, a couple of things, comments, and also too, a couple questions too as well. I mean, the first thing is, I was kind of interested in that self-direction committee, and I was kind of interested in how would someone like me, be able to get onto that, because I got a lot of problems on my end. I remember at that conference, and I hear a lot about all the good and people are able to get out in the world and stuff. I don't know. I must have missed the memo because I'm not getting anything out of self-direction. As we're speaking right now, I got really nothing to wake up to. I mean, all my workers are absentee. I mean, they use self-direction as a weapon. I can go on and on about the problems that go on. I mean, self-direction is supposed to better the life, not give care managers an opportunity not to do their job. I mean, to the fact that it gets so bad that my counselor had to step in, and he's a counselor. He's an LSW, Clearwater. He's not a care manager. He ain't a broker. He ain't a FI. He ain't even OPWDD. And he was getting aggravated too because he had to help me with my insurance. I was just about to lose my insurance yesterday. And he's trying to help me spur them on my insurance at the same time too. My food stamps is about to expire. I mean, I had to reach out to Assembly Member Dee Dee Burke's office. I don't know. They've been trying to reach out to your office. I'm still yet to hear from someone from the higher ups because it's bad from my end. I mean, I got nothing and I keep going down in the hole. No one wants to do anything. So, and that comes to the other question. Where do you go for accountability? What committee, do you have out there that does accountability? Because, I mean, the problem I'm noticing, the best way to explain this is, I know people have a lot of comment problems and stuff, but I think a lot of it has to do with some of the people that we have in the organization. I mean, there are some good people, don't get me wrong, but then there are those where you really have to wonder. I mean, me and my friend were just having this conversation the other day. He's a disability too, but he doesn't really go to these kind of meetings. But we had this discussion on Zoom, on a Google Duo, and he says the same thing too. I mean, there's some people that are just not meant to be around disability people, and they break hipper, they're rude, they let you ride 3 days of hell with no electric. I mean, that right there, it should be a fine right there, but it's hard to get accountability. So where do you go for accountability? Because it's amazing why these things happen. So it's a lot of things. And I also too, I've been trying to get the commissioner's attention. I mean, I would like to speak with her, directly about the problems I'm having. I've been having a difficulty getting in contact. I mean, the lengths I've been having to go to get the commissioner's attention. I even tried to get the attention at the state conference recently, and I was censored. Yes, censored. I mean, at the conference, someone tried to shut me down, saying, how, I don't know, I guess it didn't fit the narrative or something, but so I don't know what that was about. I mean, I've been complaining about that too, because I'm not the person that's just gonna, walk away. I mean, you can't really, you can't, I mean, ignoring me and hoping the problem's gonna go away isn't gonna go away. I ain't going away. So I need a lot of support. I'm not getting support.
Thank you for that. We're at a little over 3 minutes, and I want to make sure the four remaining folks have enough time to share their thoughts. So appreciate it.
Thanks.
John, can you just send your comments or your contact information to Rachel so that we can reach out?
You can just put it in the Q&A, John.
Sure, I'm terrible with this email thing. I'm having
you through the registration too.
I mean, I could give you my number. I don't know if that might be easier.
I would say please don't do that over this line.
Yeah.
Is there?
Sure, and if someone can reach out, I mean, I've been trying to, I really would like to talk to the commissioner because I need some help. I mean, it's not going well from my end. It's like I'm not even living, I'm a 31-year-old young man. I mean, I see I'm very much alive, and my counselor have been saying the same thing too. Where the hell is your services? This is coming from a counselor. He's saying the same thing too. I mean, he's getting appalled. I mean, I don't know. I'm running out of options here. So
Talk with you, John, and we will find a way to reach out to you. Thank you. And just to note that while all of these information that you provided is important and unifies the experience of many people, this discussion forum is more directed to the systemic issues that the advisory council is created for. And if you have individual issues, please give us your contact information and somebody will be in touch with you.
Next up, we have Sarah. Sarah, you should have gotten a request to unmute.
Hi, do you hear me?
We can.
Yes, hi. My name is Sarah Buchinger. I'm a self-direction broker, and I'm very happy to be able to speak here at the DDAC meeting. I just wanted to speak about one specific situation that I had with one of my clients that I feel like I want to bring up as an example of what point I want to talk about. So I have a client, she's a young adult, she's 25 about, and she decided to live on her own. And she went through the whole process of getting the ISS, housing subsidy, and her care manager had applied for the pre-approval. She got the pre-approval, and when she was ready to submit for final approval, her initial budget was also ready to be submitted. So we submitted both of them together, the initial budget and the final approval for the housing. That was done at the end of June. And until about 2 weeks ago, the self-direction broker, I didn't hear anything back about the budget. The FI kept on following up with OPWDD, with the regional office, and we got the automatic replies that budgets are reviewed in the order that they are received, and things like that. And then finally, I reached out to one of the workers there at the regional office that I know, and I asked her what's going on. She said that it had something to do with the housing application. She's going to look into it and let me know. She called me back that day that it's being held up for a reason. She doesn't know yet what reason. She'll let me know. The next day she tells me that the housing will be denied because the type of lease that the individual had is not open to the public, whatever. That's not the point here. Anyways, so we waited. And then a day later, I got an email from her saying that actually this housing was already denied in August, and the time to appeal it is over. So now you have to send in a new budget without the housing. So I asked her, I was not notified about the housing denial on the broker. She said, yes, the individual got a letter and the FI got the letter and the care manager got the letter, and they're supposed to do something about it. So what I want to try to explain here is that when this individual got her housing denial, she doesn't understand self-direction as well as the broker does. She didn't realize that she's supposed to tell me about it. And I was not told about this. And the budget was sitting in OPWDD's office from August until November doing nothing. No one from OPWDD told us that the budget is being held up. It was just sitting there. And if I wouldn't have called, it would have sat there even longer. And when I asked the supervisor at the regional office, he said, this is what we do. This is how our process works. If the housing is denied, we notify whoever needs to be notified, and they have to understand on their own that the budget is being held up because of that. So what I want to bring out here is that the budget was sitting there for doing nothing, and we weren't notified. I'm the broker. I'm part of the most important part of the circle of support, and I wasn't notified. So I'm sure these situations come up more, and I want to just ask that there should be some kind of work done in order to ensure that such stories don't happen again. That people that people at the regional offices are held accountable for what they do. They want to make sure that this is person-centered. If it's person-centered, then they tell the individual that the budget is being held up. It's not only this. It could be any other situation. As a broker, I come across it a lot of times. But here, this was one situation, and I'm sure the commissioner would think that this is not person-centered. So I wonder what the commissioner would say of how we should help that this story shouldn't happen again. What processes and procedures are being put into place that everything should be streamlined and everyone should feel that they are that they are dealt with as a person. They want it to be a person-centered plan and not only get over with things and just look at the ADM and follow the rules exactly. We want this to be person-centered and very good for the individuals. That's what my goal as a broker is also. So I just wanted to hear from the commissioner what she has to say about it.
So Sarah, I appreciate the comments and yes, and it's helpful to hear your experience. This is intentionally not designed to be a Q&A period so that as many people as possible can talk. So I'm not going to respond to the individual questions, but I appreciate what you shared.
Next up, we have Leslie. Leslie, you should have gotten a request to unmute. And you were unmuted.
Can you hear me? No.
You can?
Can you hear me?
Yes.
Okay, great. I really appreciate everyone taking the time to listen to the folks from the public. These scenarios may be individual, but I'm sure that's just the tip of the iceberg, and these people are strong advocates and I have a burning need to make things right and to feel heard. And I think it's great that we hear from them because their issues are everybody's issues. It's not just their particular issue. They're just strong enough and frustrated enough to bring it forward. So I'm glad that they are. I wanted to applaud the DDAC for giving folks the space to do that. I wanted to also ask a couple of questions, if I could, regarding during the employment and meaningful activities discussion. I don't remember who brought this up, but someone suggested from the council that parents should need to be involved, and we should have parents better trained to get out there and find employment for their loved ones. I really don't think parents need anything more to do, quite frankly. I'm actually on the subcommittee, and I have a kid who's trying to be employed. I won't get into it because this is not a personal thing, but I can just tell you that if we're going to ask parents to get more involved, especially with employment, that we're just going to frustrate the system, and the system really needs more staffing. You can't have whatchamacallit, customized employment without more job developers and job coaches and things like that. And we have a serious workforce shortage that we all know about. So I'll just put that aside. And then the other thing I wanted to ask during the self-direction subcommittee, Stuart brought up a community of practice. I would like to hear some more about that community of practice. Is that the same community of practice that that Commissioner Neifeld was making reference to in a letter to Senator Mannion? I was just wondering. Thank you.
Thank you, Leslie. Next up, we have Roy. Roy, you should have gotten a request to unmute.
And a parent. And I want to thank the commissioner and John and Nick. This was a very well organized and meaningful council meeting. One of the best I've been to. I heard a lot of good stuff. And Trish, I was going to say you and I ought to get together about uncertified housing because my certified housing situation is not going anywhere. But now, Commissioner, you just shot me down when you said it's not ready yet. But I'll keep hanging on as long as I can. And thank you all, and everybody have a great hour.
Thanks, George. Anyone else who has not made a comment yet? please raise your hand. If not, Nick, we are through with everyone from the public.
Okay, thank you, Rachel. Rachel, can we put up the slide of future DDAC meeting?
Yes.
So thanks to all the hard work on Rachel's part, we have our 2024 DAC meeting schedule. You'll see that our next meeting is scheduled for March 5th, 2024. We also have meetings in June, September, and December. Meetings are held from 11 to 2. We will try to have meeting locations throughout the state. It may change based on the availability of rooms, but done in this meeting. Okay, so again, for council members, you will receive an email with the meeting schedule and the location, and invite will be sent out. So you should be receiving those shortly if you haven't already. All right. I thank all of the members for attending today. Again, we appreciate everybody making an effort to attend at one of the locations. We did have a quorum today, so we were able to vote on the recommendation that was made by the residential committee. So that worked out very well. Thank you. Want to thank everybody from the public for participating. Certainly thank Commissioner Neifeld and the entire OPWDD team for participating. And with that, we'll bring this meeting to a close. I'd like to wish you all a happy and healthy holiday season and year, and we will see you all in 2024. Thank you.